Hello, my name is Dr. Alessandreo Maffato and I work at a private therapy clinic. So I trained in Italy. I studied medicine for 6 years in Torino, in northern Italy, and then I specialized in psychiatry. I followed a 5 years course in psychiatry. During my psychiatric training, I worked with schizophrenic patients, bipolar disorder patients, affective disorders patients. I worked also with personality disorders and eating disorders. After getting my specialization in Italy, I worked for about 2 years in a rehab in Torino, northern Italy, for psychiatric patients. This rehab had patients with conditions like schizophrenia and bipolar disorder, and also a unit for personality disorders. I actually became the clinical director of the unit for personality disorders. It was a quite challenging job, and I really struggled to find a way to help these patients. For this reason, I took a course in Mentalization-Based therapy in London. I reached the advanced level, and they brought back this modality to the rehab I was working in. This proved to be quite effective and quite helpful. I was so enthusiastic about the mentalization-based therapy approach that I decided in 2009 to move to the UK because I wanted to learn more and to expose myself to a different way of doing psychiatry. I started working actually in addiction, gained quite a significant experience in addiction, and then I moved to mainstream psychiatry, working in the outpatient setting for the NHS, and then in the inpatient setting. I'm currently inpatient consultant in London. I see a lot of very severe patients who have affective disorders, psychotic disorders, but also post-traumatic stress disorder, and or generally they are in crisis. I gained significant expertise in the treatment and assessment of ADHD, both in the NHS and in the private sector. And as I said before, I keep significant interest in personality disorders and in affective disorders. I have an expertise with different psychological and psychotherapeutic approaches, going from CBT, psychodynamic therapy, mentalization-based therapy, ACT, and open dialogue, which is not really therapy, but it's an approach to the treatment of patients. So all these approaches are part of the way I work and help me to give a patient better understanding of their own problems and to come to a more holistic and complete plan. One important point is that I think people can be quite intimidated by the idea of seeing a psychiatrist. It's an unusual setting. And I think it's very important that clients feel relaxed and we can establish an atmosphere of trust. This is very important because psychiatric assessment often touches areas which are potentially sensitive, and it's important that the clients feel that they can open up freely and they feel safe and respected. From a practical point of view, psychiatric assessment includes a lot of questions in reality about the so-called presenting complaint, the symptoms the client presents with, their difficulties now and their difficulties in the past. So we'll dig into their history, their personal history, their early years. I will also ask questions about their medical history because it can be important. And hopefully at some point we'll come out with a plan, which is an agreed plan, which might include medication, so pharmacological treatment. At times it might include a recommendation for talking therapy or other approaches. So obviously the approach I use is an approach which is holistic. And I always consider the patient as the expert of their own disorder, if there is a disorder, of their own life. In the end, it's an encounter between two human beings, And my role as a psychiatrist is to help and to facilitate coming to the best resolution possible. Areas of expertise are certainly the assessment and the treatment of ADHD and assessment and treatment of affective disorders. I'm talking about depression and bipolar disorders. I had also some expertise in treating OCD with quite good results over the years. Obviously, as I said before, I've been working for many years in general adult psychiatry, so I've seen a wide range of patients, many of them at the very severe end of the severity continuum. Talking about obviously psychotic patients who are very, very unwell, post-traumatic stress disorder, patients who are in severe crisis. I would say that generally speaking, my expertise with the most severe patients is very important, and because it helps me whenever I see a patient to gauge the complexity that each patient has. So I could really say that from some point of view, my strength is in the ability of dealing with complex patients and with the complexities of all patients. So if you need any help, if you need any support, and you need to see a psychiatrist, get in touch with a private therapy clinic. I look forward to being in contact with you, to see you, and I can only say welcome. If you need any help, we're here.